How are you? How is everyone doing?
I think we are doing well considering the circumstances, other than we have the privilege to examine all the victims of that tragic incident. It takes an emotional toll on everybody that works here, but we are really motivated to have answers for the family, to reunite their loved ones with their families. So that gives us the fuel we need to keep going. It's been emotionally draining, but very rewarding at the same time. As Chief Medical Examiner, I have gone nearly every day to the location where the families are, and the Office of the Medical Examiner do daily briefings, and the first day was Thursday night, Friday night, Saturday, Sunday, yesterday. Thursday, Friday, and Saturday took 3 hours of family asking questions. And the emotional part is that the families are so graceful that in their moment of loss, they have found it in their heart to thank the medical examiner for the work they do. And that tells you the type of people these families are. And that gives us the momentum for us to keep going. Just having that feedback from people that have a unimaginable loss, that they take the time, keep us motivated to come back and continue working.
You've been able to identify, it's been very quick and I guess then satisfying for the families, right? Because it's not like, it's going to take another week. When you hear the NTSB and the authorities say, like 55 sets of remains have been able to be identified, or you've been able to kind of do that fairly quickly, I guess.
Indeed, and there were 67 victims on this incident, so we have 65 already positively and scientifically identified, one that is waiting for DNA confirmation because the family member just provided the sample today. We expect to have those results tomorrow, and the last victim was just rescued. So we have 66, and the last victim just came a few minutes ago. So we recovered everybody. 65 have been identified, one tentatively identified, and the last rescue we hope to identify within the next hour or so. That will complete the identification process. I will be remiss if I don't tell you that the reason for that is the collaboration with our agencies and with the federal partners. As you know, our building is comprised of 3 agencies: the Office of the Medical Examiner, the Department of Forensic Sciences, and the Public Health Lab. So all those DNA testing that were performed very rapidly were performed by the Department of Forensic Sciences that just got accredited. And those results have been validated by the federal partners. Our federal partners, in terms of the FBI, provided us with force multipliers. And force multipliers meaning human resources, software, and how to deal with that software. And they've been embedded with us at the Office of the Medical Examiner, and more specific, the autopsy rooms. So as soon as a person is examined, then the FBI takes the friction ridge or the fingerprint, and if they're able to put it on their system, they have access to more databases, and we have identified that way 80% of the victims. And the results come back nearly instantaneously, and that has been a tremendous asset. The Office of the Medical Examiner, I couldn't be more proud of the work they've done. People don't even want to ask for overtime because they think it's an honor to serve the families. And, but from our mortuary team to our medical examiner transport team to our medical legal death investigation to our information technology identification unit as well as anthropologists, everybody's working together. Just to give you an example, last night when we are at the tail end, I was at the hotel with the families when I got informed that there were more remains to come through the office. And I said, let's examine them in the morning. And my colleagues and mortuary personnel said, absolutely not. We are going to stay here. We have people that are going to come fresh, and that way we identify 4 more people. And that's how we have gotten to those numbers. It's not only the technology, it's not only the help of the federal partners, but it's basically the spirit of everybody that works for the Office of the Medical Examiner, as well as with the Department of Forensic Sciences. Also, it's noteworthy that in this endeavor, we have had the invaluable assistance of DMORT, that is the Disaster Mortuary Operation Response Team. It's a group of volunteers comprised of forensic pathologists, anthropologists, forensic odontologists, medical legal death investigators, coroners. They get deployed on mass disasters. They're volunteer, but they are under the Department of Health and Human Services, as well as the Department of Health and Human Services also provides a team that is a medical team for mass disasters. And that they are based in the location where the families were. They have assisted us with interviewing the families, gathering information, as well as gathering medical records, dental records, and interviewing the families for every single thing that we have asked for. And that team at that location of volunteers that deployed here within 18 hours is at least 40 people. And they've been of tremendous help. And as I said, it's been emotionally draining, but the fact of interacting with the family is also very rewarding. And I can tell you is one of the most rewarding experience I have in the 30 years I've been doing forensic pathology. And you know, it is indeed an honor to try to reunite their loved ones with their families.